What are secondary brain injuries? Brain injuries are among the most serious and life-changing personal injuries caused by accidents. The brain is a complex organ responsible for all bodily functions. A secondary brain injury is a common consequence suffered by accident victims who sustain concussions and other initial brain injuries. The primary brain injury can cause secondary brain injuries due to the brain's physiological response to the initial injury. What is a secondary brain injury? These injuries are caused by a series of cellular and metabolic changes that occur in the brain after the primary injury. Secondary brain injuries can be just as dangerous as primary brain injuries and can lead to permanent damage or death if not properly diagnosed and treated. What causes secondary brain injury? Some causes of secondary brain injury include swelling. When the brain is injured, the body's natural response is to send more blood to the area in order to help heal the damage. Bleeding. Trauma to the brain can also cause bleeding. If left untreated, this bleeding can put pressure on the brain and cause secondary brain injury. Lack of oxygen. If the brain is deprived of oxygen, it can lead to cell death and secondary brain injury. Infection. Infections can occur after a brain injury and can lead to secondary brain injury if not properly treated. Increased pressure in the skull. If there is increased pressure within the skull, it can lead to secondary brain injury. What is the difference between primary and secondary brain injury? Primary brain injury occurs as a result of the initial trauma to the brain, such as a blow to the head. Secondary brain injury, on the other hand, occurs as a result of the body's response to the initial injury. This can include swelling, bleeding, lack of oxygen, infection, and increased pressure in the skull. Can you prevent a secondary brain injury? Prevention and treatment are critical steps in caring for a brain injury patient. Emergency care is often necessary for brain injuries to allow a physician to evaluate and treat these dangerous conditions. While it may not always be possible to prevent a secondary brain injury, there are steps that can be taken to reduce the risk of one occurring. These include prompt medical attention. It is important to seek medical attention as soon as possible after a head injury in order to reduce the risk of secondary brain injury. Monitoring. Patients who have suffered a head injury should be closely monitored for signs of secondary brain injury, such as changes in consciousness, seizures, and other neurological symptoms. Oxygen therapy. Providing oxygen therapy to patients who have suffered a head injury can help prevent secondary brain injury by ensuring that the brain is getting enough oxygen. Medications. Certain medications can be given to patients who have suffered a head injury in order to reduce the risk of secondary brain injury. Surgery. In some cases, surgery may be necessary to reduce pressure in the skull and prevent secondary brain injury. If you suffer a head injury in a car accident, fall, or other incident, you should go to an emergency room immediately. Secondary brain injuries can be just as dangerous as primary brain injuries and can lead to permanent damage or death if not properly diagnosed and treated. If you or a loved one has suffered a secondary brain injury as a result of someone else's negligence, it is important to consult with a personal injury attorney to understand your legal rights and explore your options for compensation.